excited today. We're having Alvaro Garza. Alvaro Garza is a medical doctor and master in public health. He is, besides being a medical doctor and master in public health, he's also a poet. And we're very excited today because Alvaro is the editor of these wonderful books, Latinx Salud Poems, an inaugural collection. So Alvaro, tell us a little bit about you and a little bit about this book.
Sure. Well,
why this book?
Well, first, I'm really glad to be with you and talking about it because I'm very excited and proud of this book. The first book, as far as I know, about Latinx Salud, or health, and poetry. So bring the three concepts together. And I, as you mentioned, I've been a poet most of my life, but I didn't start writing about non-family poetry until like 20 or 30 years ago.
Okay.
Prior to that, it was all family because that's right. And very personal. But at Latino caucus dinners, I presented and recited some poems. And I think that got a few people excited, and it got me to thinking, well, what about getting together other potential, probable, and promising Latino poets, health professional poets, and doing a book. And so the board of directors Latino caucus, Latinx caucus, accepted, and so there was a challenge to me, but I'm glad because I think we all rose up to the challenge. And it's obviously about those three things. Oh, you wanted to know about myself a little bit, so I should go back.
Yeah, but that's wonderful. So it's So you're a medical doctor.
Yes.
You're in public health. Yes. And now you also write poetry.
Yes.
Yeah. I think people probably wondering, what is the connection between a doctor in public health and poetry?
Yeah. Okay. So I think that goes again back to myself and my background, because I'm an immigrant. I immigrated when I was 8 years old from Mexico. And so I grew up right on the border and often went to Mexico. So all those experiences really impacted me.
Okay.
My father had studied medicine 1 year in Mexico, and then he couldn't finish for lots of reasons, mostly family, growing family, and kind of poor. But that got me to thinking I can do what he didn't do, and so I went into medicine.
Okay.
And so then, not just medicine, but I went to pediatrics, and those experiences, still on the border, if you will, I always wanted to focus on Latino community, Latino people, Latino community, and I did. And eventually, though, I went to public health because I was starting to think upstream back at that time. When in the early 80s, I was seeing similar problems but rotating faces and names. We got to be able to prevent disease, so I went to public health. And so all along I have kind of steered my professional life towards doing what I can to improve the lives of Latino communities. And being that I wrote poetry, I do think, because I read, what I read is often medical literature, yes. But I also read some poetry that keeps me going. And I read this elsewhere, that the more common person, meaning non-health professionals, can relate to poetry better than they can relate, obviously, to a medical journal. And the jargon there. So as I've been working on and the activism of trying to work on improving the health of Latino communities, putting that into the poetry. So that's how I've been writing for the last 10 or 20 years, I think. And some of those are in here. So that's how I mix those three. the Latino and my
Latinos,
immigrant experience, my
immigrants.
health professional background, and then my poetry.
But it's interesting you talk about prevention. So as
Yes.
a way to kind of address the health issue in the community, and maybe a better way to address health issue in the community.
Yes.
And also the people probably would be more prone to read poetry than to read a medical journal.
Right. That's
So do you see that like a way to kind of get or reach those people who are, would be easier to approach to poetry and prevention and health?
yeah. Basically, to get the disease prevention, health promotion, protection, health and well-being for
Right.
more people every day, everywhere, and I think honestly we can reach more common folk that way. So to get them to ask them to also become activists and advocate for it.
Right.
To ask them to vote, for example. In fact, in one poem I asked we should all vote.
Oh,
I mean, I write we should all vote. When I talk about the border and the immigrants crossing
Right.
the border and the nasty things happening down there.
yeah.
So that's part of my activism, if you will. And I do think we, little by little, will reach more and more folks.
Okay.
Hopefully even the decision makers like policy makers, legislators, etc.
Right.
At different levels.
So it's interesting you say that. So what I hear is that you use poetry as a tool, as a tool related to health, a tool
Right.
related to public health.
Right.
So there are other
It's-
ways to do work, in terms of health besides going to a doctor at a hospital.
No, exactly. And in fact, even some medical doctors are using in their armamentarium,
Okay.
their regimens, poetry or other art forms
Okay.
to help in the healing process.
Oh, that's wonderful.
Okay, so again, the healing process, the doctor work, which I left a while ago because I was a pediatrician.
Okay.
Went to public health because of more upstream and more prevention. But the poetry and other art can be used downstream at the doctor's office, in the hospital, and can be used upstream as well in making more obvious the injustices.
Okay.
So that's where my activism and poetivism, I call it, poet activism,
So
comes
there's
in.
a really strong connection between all of
It is in my head, for sure. I don't know that I have it in other people, but I'm going to make that case more and more.
Yeah.
That, let's get out these thoughts that I write anyway,
Yeah.
To more people to understand what we can do. But I'm really glad of and proud of the
Yeah.
other poets that are
Right.
we have in the book,
Yeah.
because we have, besides myself, 16 others,
16 others. So there's 17 authors.
17 total authors,
17 total.
48 poems.
48 poems.
And I was the editor, as you said initially, and
Yes.
I grouped them all into 4 areas.
Okay.
And I'm very proud because there are several about mental health,
Mental health.
some about physical health,
Okay.
some about public health, and some about social health. The kind of my focus the last 10, 20 years is
Okay.
social health,
Right.
like the political
Like
type,
a political type.
social
which is,
justice, health justice type
Right.
of thing. But some of the poets in here write about mental health, for example, rape and violence
which are very important
and
issues.
physical abuse.
Yes.
I have one in there, mental health, about being alone and loneliness.
Right.
And there's some in physical health about diabetes, for example.
Okay.
And exercise. So, and then in public health, I forget what we have in there about public health, but we do have
Right.
some.
Yeah.
And then the social health, like I said, about
Yeah.
immigrantism
Yeah.
and racism and such.
Okay. So are these all authors poets themselves, or what is their background? Is
Right. We all vary.
okay.
But most of us are amateurs, dilettantes.
Okay.
There's only 1 or 2 maybe who are more accomplished at poetry.
Right.
But it's really, and as you said, and I've said, I've been doing poetry for many years, although I didn't start to be taken seriously until like 10 or 12 years ago. at the University of California, San Francisco.
Okay.
I submitted one poem and I got first place
Wow.
on,
That's
on,
amazing.
on a call for creative work
Okay.
about diversity within the
Right.
campus of UCSF.
Right. So it's amazing that there are 17 in total authors.
Yes.
If I understand correctly, they all have a public health background. They all work in
Not
public
quite,
health.
but almost all.
Almost, almost them all. And they also have a passion for poetry.
Yes.
And the poems are about, as you said, 4 different categories.
Yes.
So poetry and social justice and health. It's how do you guys achieve that combination and come out so beautifully in the book?
No, well, each of us wrote what is in our background and what is in our experience and what is in our sentiment, if you will.
Okay.
And what we have a passion for. So, and the 17 of us, then the sum of in here, I was able to group them that way.
Okay.
But I forget all the different. I wrote one on each of those.
You wrote
now that I'm
in
thinking,
each of the 4 groups.
yeah, mental health, physical health, public health, and social health.
Right.
Not all poets wrote that way. I mean, at least one wrote only on mental health.
Okay.
For example, the domestic violence
Okay.
or the rape, that sort of thing, because that's her experience.
Yes.
And others wrote about other issues. So,
Okay. Great.
but altogether, we're so much better, it seems.
Great. So about the book itself, what was the experience of being the editor of the book, of from starting from scratch just to get this this great book? What was the experience?
It was hard work.
Okay.
I'll tell you right now. It was hard work, but very satisfying
Great.
because I instigated it.
Yes.
I inquired with the board of directors, Latino Caucus, and you graciously accepted me to kind of lead, if you will, at least be the editor. And I'm glad I did it. It was great, it was, as I said, satisfying. Although it was hard work to spend. I was easily spending 20, 30 or more hours a week as we were collecting the poems and I was editing them.
Right.
Getting back to the poets, getting them back and so on, putting it all in shape.
Yes.
And I wrote the intro and the epilogue and so on. But I'm really proud of the work. I'm really satisfied with it. It's hard, but it's well worth it. And I hope we can maybe do it again.
Yeah.
In a year or 2 years or whatever.
Yeah, but
because I do think there are other Latino health professions, poets, or who don't know it,
right,
are waiting to be found, if you will, and waiting to get published.
So this is definitely an inspiration for other, public health workers who also have a passion for poetry. And to our audience, what will be your message?
Okay, so the majority, kind of a focused audience, if you will, in my view, are health professionals. Not only health professionals, I want the public.
Okay.
But for the health professionals, I think we can use select poems in our daily work. So in clinic or in hospital, for example, or in giving lectures, professors talking about a topic. I mentioned earlier about domestic violence or rape.
Okay.
So a physician, a clinician, not necessarily a physician, nurse, etc., could be with the patient, mental health professional,
Right.
about violence. They could perhaps read or with the patient or ask the patient to read one of those poems and then talk about it and how it relates to that person. And I do think others can use some of the poems in here in discussions with students.
Okay.
Med students, nursing students, dental students, etc., whatever, public health students, obviously. On whatever topic is in here, those 4 areas that I mentioned,
Really,
mental, physical, public, and social health. And then finally, the general public is to, hopefully as these get known, can then also share them with their local politicians, and that they become more aware from their constituents about some of the social justice, health equity, health justice that are in here. And in my own personal perspective, it's right now because of the state of affairs on the border and in Washington, D.C.,
Right.
it's about immigrants and immigrantism. So that's how I hope it gets used.
Well, I hope you guys can get this wonderful book. It's really an inspiration, and I want to thank Alvaro, for being spearheading this wonderful project. So thank you very much, Alvaro.
Great, thank you. Excellent.